the Republican reaction to the speech is Senator Jim DeMint. He is a member of the Commerce and the Joint Economic Committees. And, Senator, thank you for joining us this morning.
Thank you for having me. Good morning.
You know, you threw down the gauntlet the other day when you said this is the president's Waterloo. If this doesn't get passed, it's going to change everything. Do you still think that that's the case?
Well, the president was having to dance around the facts last night, and unfortunately, he's been on a stampede to increase spending and debt and taxes and takeovers of various aspects of our economy. And I think the healthcare industry, if the government takes over the healthcare industry, I'm afraid it might push our country over the cliff. So this is a big battle for us here. We can reform healthcare. We can get more people insured. We don't need the government to take it over. I've probably introduced more health reform proposals than any Democrat in the 4 years I've been in the Senate. The president voted against all of them when he was here. So I really question whether he wants people to have insurance or whether he wants the government to take over health care.
Senator, the president laid out in one line, he talked about how he said, if somebody told you that there's a plan out there that's guaranteed to double your health care costs over the next 10 years, that is guaranteed to result in more Americans losing their health care, and that is by far the biggest contributor to our federal deficit, I think most people would be opposed to it. That's what we have right now. Now, you talk about change, but is there any sort of consensus that you think could be built around to actually come up with significant reform?
Well, again, the president voted against reforms when he was in the Senate that would have helped individuals buy health insurance if they didn't get it at work, that would have helped the unemployed get health insurance. I've introduced proposals, as have other Republicans, that would give people, families, a $5,000 a year voucher to buy health care if they don't get it at work. The Heritage Foundation says within 5 years we could have 23 million Americans insured for a fraction of the price that the president's talking about. So what we need to do is focus on getting more people insured, not this idea of thousands of pages that have to be passed in 2 weeks. You know, I'm amazed to hear him say that we've got to get this right, and then he turns around and says we have to vote on a bill that we haven't seen within 2 weeks. We've got to put the brakes on this. We've got to slow things down. The language in the bill doesn't take effect until 2013. So why the mad rush to totally take over a health care system at the federal level?
The president has said that the health care insurers have behaved badly for years and have not pulled back in line when they've been given opportunities. He says that there needs to be a public plan that forces them to get in line. How do you think that any sort of excesses or overspending or undercare coverage
There's no question
should be fought?
There's no question the health insurance industry needs a lot more competition and scrutiny. But the president voted against a proposal that would have allowed Americans to buy health insurance anywhere in the country instead of being trapped in their own state, often with 1 or 2 insurance monopolies. We need competition, but we don't need the government to come in and create a plan. We need to let Americans buy health insurance anywhere in the country like they can buy anything else. But the fact is that President Obama and the Democrats have tried to block this kind of competition for years. So what we're trying to do right now is just expose the truth. The biggest casualty of this debate has been the truth. The president makes promises, but the policies don't carry out those promises. And that's not just a partisan view. That's a view of the Congressional Budget Office, of outside groups that are looking at this, and they're saying 80 million Americans will lose their health insurance if we carry out the president's plan.
If the public plan proposal is dropped, let's say that happens, can you work with the president and the other side on crafting something that would help, that would reform health care?
I would love to reform health care in a way that made health insurance more affordable and accessible to every American. That should be our goal, that every American has a health insurance plan they can afford and own and keep. But I don't want a plan where he says, okay, we won't have a public plan, but we're going to put mandates on every policy that it has to cover abortion and every other thing that is on their liberal agenda.
Well, would you require all Americans to pay for health insurance like they're required most of the time to carry car insurance?
Well, that shouldn't be our first step. The first step should be to make sure it's affordable and available. And if later on we find out that we need to have more incentives for people to own health insurance, we can do that. But the fact is, we haven't even tried yet. The Democrats have blocked everything that has been proposed over the last few years that would make health care more affordable and accessible. And I've got a whole list of things that I could give you, but they will not even allow it to be deductible. if the cost of health insurance for an individual who buys health care, just like we give to businesses. So I'm just confused about what the president is trying to do here. If he's against real reform of health care, it appears that all he wants to do is get the government in control of our health care, just like it is of General Motors and AIG and our banking system.
But what I'm hearing you say, Senator, is that even if he drops the public option, that would not guarantee support from Republicans like you. Is that fair?
Well, it would guarantee we would want to work with him, but the fact is now they're trying to jam something down the throats of the American people in secret. We don't know what this plan is, except they're changing it every day. We've got over 1,000 pages that we're trying to rifle through to see what's in it. We want to work with the president. We've tried to work with the Democrats. I've introduced bipartisan health reform legislation before with Democrats. But what this president is doing is not health care reform. It's a government takeover.
I guess what I'm saying, though, dropping the public option would not be some sort of panacea to getting something done.
Not necessarily. What we need is a real focus on getting Americans insured.
Last night, there were some reports that said he dropped a reference here or there to the public option, and people want to read into that he's maybe open to a policy shift. Do you think that's what happened last night?
Well, he was dancing around. He didn't give us any new information, but he, again, giving promises that aren't in the policy, and he seems to be wavering on whether or not we have to finish this in 2 weeks. If he wants to get it right, we need to sit down at a table and work together and come out with something that'll get Americans insured. That needs to be our goal. A government takeover should not be our goal.
But, Senator, I share your concern about getting the truth out. You know, one of the issues here is that we're hearing all of the potential glamorous positives, but we may not be looking at the negatives. I was talking to a friend recently who talked to a father in Canada whose daughter had just been diagnosed with terminal cancer without immediate treatment. And he was sharing that under their universal health care government control system, they had to take a ticket, stand in line. It would be 9 months before his daughter could get treatment, and she would be dead. Yeah. And so now, of course, his only option, thank God, is he can maybe come to the U.S. and get treatment. But are we really hearing the downside of this, in your view?
No, we're not really hearing the truth. And the president is trying to make this about him. He's trying to say this is partisan. It's not partisan for me. I had a small business for years. I had to buy health insurance for my employees. I know what we need to do in order to get more people insured.
Well, Senator, I mean, to say that it's not partisan sort of flies in the face of you saying you want to break him, or that this will break him. I know you haven't backtracked on the Waterloo comment, but some of this is politics, not policy, right?
This is all about bad policy. It has nothing to do with Republicans or Democrats. Republicans have a lot of different plans.
Well, then why rhetoric like that, Senator?
Well, it had the desired effect of getting people's attention that this is a very important debate. It's very important for our country. If we allow this to go through, we could break our country financially as far as the debt we're creating, and this healthcare system that's the best in the world could become a Medicaid system for everyone. It's a real important issue, and we cannot allow the president to push something else through
Senator,
with glowing rhetoric that's not backed up.
Can I just ask you, though, you said that you think that this is an issue that is all about him. I mean, personally, I look at this as an incredibly confusing issue that a lot of people are coming at from different perspectives, probably most of them with the best interests at heart of trying to get to a solution. You don't think that's the case?
Well, there are a lot of good intentions here, and there's some folks who honestly believe that the government can run the most personal and private service that Americans want today. So I'm not questioning good intentions. And again, it's not personal. It's not about politics to me. It's about something that really works. And I've worked in healthcare years before I came to Congress. I have a little bit of knowledge about it, and I know that the proposal that's on the table will destroy our healthcare system.
We had Senator Voinovich on the show yesterday, and we asked him what percentage of all of this disagreement is about declawing the president, and what is it? How much of it is just avoiding bad policy? He said it was about 50-50, but I'm sure you would agree that if Republicans succeed in killing this plan, it will be good for your party, right?
No, it won't unless we get a proposal on the table that the Americans can see that helps them get insured. We want people to look at our proposals. We're the ones who've been introducing health care reform in Congress for years. The Democrats have been blocking it. Now they're throwing up their hands and saying, look, the system doesn't work. The government needs to run it.
All right.
Senator, thank you.